And UK Prime Minister Boris Johnson says Britain is set to massively increase testing to combat the spread of Covid-19, yet Johnson's Conservative government has come under fire for failing to keep its promise to increase the amount of testing being done. Let's take a listen to what the Prime Minister had to say.
And I want to say a special word about testing because it is so important. And as I've said for weeks and weeks, this is the way through. This is how we will unlock the coronavirus puzzle. This is how we will defeat it in the end.
And the Prime Minister making those comments as the country on Wednesday saw its biggest day-to-day rise yet in deaths, with the toll rising to more than 2,300. Let's cross now to Chris Moore, who's in Lewis in East Sussex. Chris, this issue of testing is sparking much fury in Britain, isn't it?
Certainly is, yes, and making a lot of headlines this morning in there. The fact of the matter is that there are about 500,000 National Health Service staff involved in the frontline fight against coronavirus. And as things stand, by the government's own admission, only 2,000 or so have been tested. What's more, we think about 125,000 NHS staff are currently self-isolating. Unaware of their coronavirus status, unaware of whether or not they are fit to return to work. And a lot of questions being asked of the level of testing in the United Kingdom, around about 8,000 a day so far. Germany, of course, is famously carrying out 70,000 a day. That's not the only headache for the government. Unions have been sounding the alarm bell over protective clothing and equipment for frontline healthcare workers, saying that in some cases it's not arriving, in some cases it's inappropriate or out of date. And we've also had the British Medical Association saying it's going to have to make some tough choices in terms of who receives critical care faced with a lack of ventilators. Now, on the testing, we're expecting the Health Secretary, Matt Hancock himself, coming out of self-isolation to give more details today. You heard the Prime Minister there saying how vital he felt it was. But the message seems to be that this is going to be a question of time. The government looking to get the number of tests up to 25,000 per day, but that could take some time. On equipment, the government saying, well, it has been looking both here in the UK and around the world for supplies. But of course, like everybody else, like every other nation, it's part really of what has become a kind of international arms race for equipment. Countries looking to outmaneuver each other, in some cases outbid each other. And the fear is, of course, that as the numbers increase here in the UK, some of that equipment might not arrive in time for a peak, which some scientists are suggesting could be within the next 2 to 3 weeks. Others, however, are saying it could be a little bit later than that. And in terms of figures, that could buy the government a bit of time.
And the government also coming under much pressure over its lockdown, Chris.
That's right. The UK seen as a bit of an outlier until a couple of weeks ago, when it did change its approach on the advice of scientists, going for a more aggressive lockdown, more aggressive social distancing. You were talking about the figures there yesterday. The UK recorded 563 deaths. These are the kind of rates, the kind of increases which were seen further into lockdown measures in other European countries, France being a notable example. The government also being asked questions already about its exit strategy for the lockdown. We may get more details on this later on from Matt Hancock. But again, questions being asked about testing. There are, of course, two types of tests involved. One which effectively tells you if you currently have coronavirus. One which tells you which you have recovered from it and are therefore allegedly immune and fit to go back to work. It's not clear where the government is looking to put the balance there. One potentially better bit of news for the government in terms of that social distancing, of that lockdown, is that some of the scientists who encouraged it are saying that things are moving in the right direction. The aim is to get the infection rate below 1, namely that each person infected transmits to a maximum of 1 person. One study from the London School of Hygiene and Tropical Medicine saying that if these lockdown measures work as intended, it will go down to 0.62. So that is an encouraging figure, but obviously it's not going to be borne out in terms of the overall figures for infections and the death rate for several weeks yet.
Chris Moore, thank you.